Good evening. My name is Rondi Bacolod. I am from school Phinma, a second year medical student. What's your name?
My name is Joel from Elizaga.
How old are you?
I'm 21 years old.
Alright, Joel. I will be performing the musculoskeletal exam. Is that okay with you?
Yeah.
Alright, so for the first exam, I'd like to examine your muscles of mastication, temporomandibular joints. Could you take off your mask for me, please?
Yeah, sure.
Hands here. Go ahead and clench your jaw. Going up to from the masseters, pterygoid muscles, and also the temporal muscles. Very good. Thank you very much. I'll also be using a glove to inspect the internal pterygoid muscles. Go ahead and open your mouth for me, please. There's one. Okay. Thank you very much. All right. Next, we're going to examine your range of motion, your gliding and hinge motion of your jaws. So go ahead and open your mouth for me. You say ah, and close them. Okay. Open your mouth again. Protrude your jaw for me. There you go. Retract them. Good. Okay. And then also move them from side to side. Okay. Go ahead and open your mouth as wide as you can. Normally we can insert 3 fingers here. Okay. For the next exam, we're going to inspect and palpate your shoulders. I'm going to ask you to take off your shirt. You don't have to. And then we'll just do an inspection here. We're going to inspect up to the shoulder girdle just to see if there's any kind of swelling, if there's deformities or muscle atrophy, fascillations, or if there's any kind of unevenness on one side, because you could have scoliosis if one leans toward the other, or if there's any bursa that may be swollen. So everything looks good. Next, we're going to test and see your range of motion for your shoulders. So for the first one, it's going to be flexion. I'd like you to follow my hands. Just go towards the front and all the way to the top. Very good. For extension, push your arms backward towards the back. There you go. For abduction, I'd like you to raise your arms up as if you're flying. There you go. For adduction, go ahead and raise your arms forward and cross them over for me. There you go. Very good. For your next one, it's called internal rotation. I'd like you to turn to the right. Turn so that you can see your back. Okay, go ahead and reach for your shoulder. There you go. And try to reach for your shoulder blade right there. Do it on the other side as well. Very good. For external rotation, I'd like you to raise one of your arms and then go ahead and try to comb your hair to the back. So go ahead and do it on the other side as well. There you go. Thank you. Okay, we're going to do 2 composite tests. The first one, I'd like you to push your arms out like this with your elbows right in the shoulder. Go ahead and try and push them outward for me. Good, you have good strength there. Thank you. The next one, go ahead and lift your arms straight with your thumbs up. Go ahead and widen them to about 90 degrees. 90 degrees, about V-shape there. Go ahead and turn as if you're emptying a can. Alright, now, I'd like you to resist this force for me as I push down. Good. Next, I'm going to examine your elbow. I'm going to palpate the electron process and also in between them and the epicondyles, check for anything that's unusual. Doesn't look like there is. Go ahead and give me the other side of your elbow for me. Alright, thank you very much. Alright, so we're also going to test the range of motion for your elbows. Go ahead and bend your elbow up like this. Good. Go ahead and look down. Go ahead and, as this is called supination, is when you are as if you're carrying a bowl of soup. Very good. Okay, now, and pronation is also, go ahead and turn them over like this. Okay, palms down. Good. Thank you. Next, I'm going to be examining your wrist joints. Go ahead and give me one arm. I'm going to palpate your wrist. I'm going to palpate your ulna, your radius. I'm going to check here the anatomical snuff box. Also, I'm going to check your MCP joints and checking in between them as well for any unusual signs. Okay, looks like everything's good. Go ahead and give me the other hand. Okay, so next we're going to check the range of motion. Okay. Go ahead and put your arms out like this for me. Okay. Now for flexion, go ahead and point your fingers towards the floor. There you go. And extension towards the ceiling. Good. Right towards the middle. We're going to do adduction and point your fingers towards each other. And then abduction, which is pointing your fingers out. Very good. The next part, we're going to test your hand grip strength. Alright, so I'm going to point my 3 fingers here. Go ahead and grab, test your grip strength. Go ahead and pull for me. Pull. There we go. Very good. Next hand. Pull. Next, I'm going to test for the carpal tunnel and specifically the median nerve. So for this first one, go ahead and put your arms out like these, and then stick your thumbs up for me. Now I'm going to apply force and go ahead and resist it. Very good. All right. Next, do the tunnel sign, which I'm going to go ahead and put your hand out. I'm going to be testing the median nerve. If you feel any kind of sensation, just let me know. Okay, next one. No. Next is the Fallon sign. So go ahead and follow me. You're going to compress. Yeah, there you go. Just like that. This compresses the median nerve, so if there's anything unusual happening, looks like everything is okay. Thank you very much. I'll go ahead and turn a little bit more. There you go. Thank you very much. Alright, I'm going to be examining your spine, checking the thoracic, lumbar, and cervical, just to see if there's anything unusual going on here. So check the spinal column, and also the gluteal folds. See anything unusual? Thank you very much. I have a patient here standing. We're going to go over the range of motion for the spinal cord. So go ahead for this first one. It's going to be flexion. Go ahead and try and touch your toes as you are standing. All right. Next, we're going to go over extension. Go ahead and turn around for me. Put my hand here to support you. Go ahead and bend your back. Look towards the ceiling. There you go. All right. And for this next one, it's going to be rotation. So I'm going to put one hand here. I'm going to have you rotate. There you go. Rotate the other way. Okay. Again. Okay. Go ahead and face me. Alright, this is the next part is going to be lateral bending. So I'm going to put one hand here to stabilize. Go ahead and bend towards your right side for me. Bend this way. There you go. And other way. Go ahead. Alright. Thank you. There's a good range of motion. Next, we're going to test the range of motion for the hips. So for this next one, it's going to be flexion. Go ahead and put your knee towards your chest and try to hold it there. There you go. Next one. Alright. After that, go ahead and put your hands here. We're going to test for extension. Go ahead and, yeah, there you go. Push your leg out like that. The other side as well. There you go. Oops, there you go. Next, we're going to do abduction. Go ahead and put your feet together. Take one leg and extend out this way. There you go. Next. Okay. The next one is going to be adduction, so go ahead and lift your leg like this. There you go. Other way as well. There you go. So I have my patient sitting for internal and external rotation of the hip. So for internal rotation, we're going this way. So you have your hip turning this way. And then for external rotation, this way. And same thing on the other side. Internal rotation, external rotation. Next, I'm going to palpate the knee, checking individual bursa, the suprapatellar pouch, prepatellar pouch, also the anserine pouch, just to see if there's any swelling. Do you feel any tenderness? No? Okay, good. Oh. Also the other side, I'm going to do the same thing here. Okay, I'm also, if you can't see here, checking the medial aspect of the popliteal fossa as well. On both knees. Okay, next is going to be knee joint effusion, checking to see if there's any kind of liquid in the bursa or behind the knee. Alright, so the first thing I'm going to do is called the bulge sign. So I'm going to press down here up just above the suprapatellar pouch, or I mean just on the suprapatellar pouch, I'm going to press medially here, and I'm going to tap here to see if there's any fluid wave. Again. Oh, nothing. So looks like everything is good. And I would do the same thing on the other side as well. The bulge sign is for minor effusion. The next two I'm going to do involves major effusion. The first one will be the balloon sign, in which I will squeeze the knee, basically from the top and the bottom. I'm also going to double check and see if there's any fluid wave from the sides. Okay, nothing there. And I would do the same thing on the other side. The next I'm going to do is the ballotting of the patella, in which I will do similar as the balloon. I will squeeze, and then I will also press the patella against the femur and check and see if there's any fluid waves. And there's none. And I would do the same thing on the other side as well. Next, we're going to proceed to the McMurray's test. So I'm going to have my patient go ahead and lift your legs about 30 degrees. For the McMurray test, we're going to check medial and lateral meniscus. For the medial meniscus, I'm going to put my hand here in the lateral meniscus area. I'm going to put it my right hand here in the medial aspect of the ankle, and I'm going to twist this way just to test and see if there's any reaction. Also for lateral, I'm going to do the opposite, twist outward and see if there's anything there, and I will do the same thing on the other side as well. The positive sign for McMurray's is there will be a palpable click or a pop. The next is going to be the abduction stress test, or the valgus stress test, and the adduction stress test, or the varus stress test. So for the valgus stress test, I have my patient straighten his legs out. I'm going to lift one side, and it's very similar to the previous test, but except this time, instead of twisting, I will push on this side here, and from the ankle medially towards the lateral side. So I'm going to do it this way, and then for the varus test, I'm going to do the opposite. And then I would do the same thing for the other side. Pain and lateral gap is positive for either side. Next, we're going to go over the anterior and posterior drawer sign. So I'm going to have my patient his legs be at about 90 degrees, and then for anterior draw sign, and then I'm going to have his leg at the 90 degree angle, and I'm going to push this way for anterior draw sign to check and see if there's any injury in ACL, and if it's positive, there would be forward jerking showing contours of the tibia. And then if I do the same motion except reverse, which is pull back, this is posterior draw sign. And if the proximal tibia falls back, this is positive for posterior drawer sign. In the Lachman test, I'm going to basically be pulling the tibia forward and the femur backward together at the same time simultaneously, and check and see the degree of forward excursion. So do it here, bend your knee a little bit. There we go. Relax, and there we go. And if there's any significant forward excursion, then that's positive sign for an ACL tear. So the last test is the test for the motion of the ankles. We're going to I'm going to have my patient go ahead and point your toe towards the floor for me. This is for flexion. Point it towards your face for extension. There we go. Go ahead and relax. For inversion, bend your heel inward. Bend your heel inward. Heel inward. There you go. And for eversion, go ahead and bend your heel outward for me. There we go. And then we would do the same thing on both sides. So our patient, Joel, has full range of motion in upper and lower extremities, in the jaw as well, and everything appeared normal. There were no deformities, swelling of any kind.